Hi class, welcome to the lecture on research design. Your book does a really nice job of talking about both experimental and non-experimental design, so I'll go through and hammer home a few of the points, but I will generally try and keep it fairly brief because I think your book does a pretty nice job in this section. I say this all the time about analyses, about methods, but choosing a research design also involves many factors, one of the most important of which is your research question. And all of this should always be coming back to your research question, your methods, your design, instrumentation, etc. Figuring out what it is you really want to know, determining if you want to examine a causal effect and if that's possible. Obviously, ethical issues are a big factor in research design. How can you address your question without violating any laws, harming any subjects, going to jail, etc. Cost is a huge piece. And cost and practical concerns are in some ways almost as important as the research question because they have significant implications for what you can actually do. So what can you afford to do? What's your source of funding? How likely are you actually to be able to do this? And I think in a reasonable amount of time is an important piece of this question, particularly thinking about your dissertation research. I would strongly suggest that you don't propose some huge longitudinal study that will keep you in this program for longer than you need to be. And then you have to think about access to the study population. So who are you looking at? How many of them are available? How available are they? How much do they generalize to this larger population? And so we're going to cover each of experimental and non-experimental designs. For experimental designs, I'm going to go into a bit more detail than your book does. And then for non-experimental designs, I'll do a quick overview of some of these basic issues. So in experimental designs, the researcher is actively manipulating something. The bonus to experimental designs is that it facilitates a greater degree of control over the variables of interest. Isolating cause and effect, controlling for extraneous factors, and so it gives us a lot more control, and as we'll talk about, and as your book talks about, it increases internal validity. Your book does a nice overview of laboratory versus field and the variations in external validity according to laboratory versus field. This is a really interesting piece to me doing alcohol research. There's a lot of laboratory-based alcohol research where we bring people into labs, get them drunk, ask them to sort of project what they would do if they were actually in a sexual situation. And then a lot of that research is used to inform what we know about the connection between alcohol and sexual behavior, sexual thoughts, and cognitions and emotions. So this laboratory versus field is a really important component of how we think about designing experiments. And these, again, are really used primarily for testing causal hypotheses. And there are a lot of designs to choose from, and I'll go over a few of those. Your book doesn't really go into some of the designs. The Creswell book does go a bit more into the specifics of these designs, so you can read a little bit more about that if experimental design is something that you're thinking about doing for your dissertation or for research that you want to do moving forward. Again, these decisions still stem from all of these basic considerations. So I'll go over fairly quickly some of the notation for experimental design. A lot of what you see about experimental design will have some of the same authors in the 60s, 70s, and a bit beyond. You'll see Campbell, which is one of the sort of seminal texts on experimental design. You'll see Shadish, Cook and Campbell, some variation of those names. And they were all the old white guys in the 60s who developed some of this nomenclature and some of the basic ideas behind these designs. So I'll show you some of these designs, maybe make note of some of these notations at this point, and then some of the notation that I use moving forward will make more sense for you. So X is this independent variable. X2 or Y are additional treatments or independent variables. O is observation or measurement point, an assessment point of our dependent variable. Random assignment is R, And the way that we lay these out, X's and O's in a horizontal line, indicate the same group of persons or people, and X's and O's in a vertical line are simultaneous. That will make a bit more sense when you see what I'm actually talking about, and I'll walk you through those. And parallel rows are separated by dashed lines, indicating non-equivalent groups. And we go left to right, much like we read. So I'll come back to that in just a second and show you some of these designs. A quick overview of some definitions, which I think your book does a pretty nice job of. Experimental group is obviously the group that gets your manipulation or your intervention. The control group is a group that does not get the intervention that you're interested in testing or the manipulation that you're interested in testing. And I'll talk a bit more about this in a moment, but I think it's really important to think about what they do get. Do they get nothing? Do they get something that is more similar to what they would get in regular settings? To what are we comparing our manipulation or intervention? Random assignment is randomly assigning participants to our comparisons groups. So experimental group versus control group, different experimental groups or control groups. Another way of going about this is matching. And so we can try and equate our comparison groups either at the outset of an experiment or in finding some sort of a comparison group. And we would use matching in a situation where maybe we can't randomly assign people to groups. And we'll talk more about that in quasi-experimental design. All experiments have a post-test, a measurement of the outcome after the experimental manipulation. And many true experiments have a pretest, not all of them, but a pretest is the measurement of the dependent variable before our manipulation. And this is not necessarily required, because if we're randomly assigning people to our conditions, presumably there will be no pretest differences between our groups. If we randomly assign everybody, then theoretically any variability in our outcome variable or in other kinds of variables, demographics, things like that, should sort of even out. It should be equally randomly distributed in both of our groups. That doesn't always happen. Sometimes it just by fluke, we have one group who is significantly older than the other group. And so doing the pretest for either the outcome variable or for other factors allows us to check on the effectiveness of random assignment. And we'll talk a bit more about how we can use pretest. So I'll talk about pre-experimental designs, experimental designs, and quasi-experimental designs in this lecture. And I'll give you a few different pre-experimental designs. This is where this nomenclature comes in. So this one-shot case study design is when we would have a single group, we give them a treatment, and we follow it up with a post-test measurement. So there's no randomization, no control group, no pre-testing. You just expose a group of people to a manipulation or an intervention, and then measure an outcome. A one-group pre-test, post-test design, a very similar thing, but we have a pre-test. So a single group pre-test, then some treatment or manipulation, and then a post-test measure. A static group comparison design is a comparison group that doesn't receive a treatment. So this is this control condition. So the other group receives a different treatment or no treatment at all. And you get some manipulation in one group and then a post-test assessment in both of those groups. And for pre-experimental designs, these are good in situations where ethical issues may prevent differential treatment. These may be good for pilot tests if we're just looking for a signal in some way that our manipulation or our intervention might be effective. And we may just want to do a very simple, very straightforward assessment of that intervention or manipulation to see if we're getting any sort of effects at all. And then we can move forward and do more complex tests of that manipulation or intervention later on, once we feel somewhat more confident that we're going to get something, that we're going to have a signal there. Obviously, disadvantages to these pre-experimental designs. They don't account for extraneous variables, they don't involve random assignment, and so it's difficult to make causal conclusions in these designs. And there's no pretesting, so we can't account for pre-existing factors or differences in the groups if we have multiple groups. So true experiments involve at least two comparison groups, an experimental versus a control group, and that helps us to establish an association between the independent and the dependent variable. There is variation in the independent variable before assessment of change in the dependent variable, and so that helps us to establish some temporal ordering. So we know that the independent variable came before our assessment of the dependent variable. And then random assignment to 2 or more comparison groups. And so, again, theoretically, if all participants are randomly assigned to a condition, there will not be any major differences between the groups. So one's older than the other, riskier than the other, different on your outcome measure in some ways. Again, that variation should be randomly distributed if we use random assignment. And so there are a variety of true experimental designs, and I'll go over a few of those. Post-test only control group designs. So this is where we get randomization. So this looks very similar to the pre-experimental design, except that we have this randomization piece. And so we can facilitate equivalence in the groups before we do any sort of manipulation. There's not a pretest in this measure, so we just see here we have randomization, we have whatever manipulation or intervention we have here, and then we have our observation. So we don't have the potential confounding effects of a pretest. For pretest, post-test control group design, I would say this is what we think about as sort of the most traditional experimental design. We have randomization to groups. We have the pretest observation. We have one group who receives our manipulation or intervention, one group who does not, and then we have a post-test for everybody. So this controls for a lot of the threats to internal validity. It allows us to do some pretest comparisons. It allows us to look at change scores to see not just the post-test differences, but if there are differential rates of change in each of these groups. We do have the potential for a pretest intervention interaction, so reporting on the pretest potentially affects behavior or the reports on the post-test, and we'll talk more about some of those threats to validity in just a second. And your book does a nice intro to that. A Solomon four-group design is also considered in a lot of ways a sort of gold standard of experimental design. It's much more complex in a lot of ways. So we have random assignment to 4 different groups, and so pretest and treatments are varied within these 4 different groups, but all of them receive a post-test. So we see here that there's randomization to 1 of 4 groups. 2 of these groups get a pretest and 2 do not. And 2 of these groups get whatever the manipulation is, and 2 do not. And so we see that we have this sort of 4 square options of the pretest and intervention groupings. And so we can get some comparison of treatment to control, and we can also examine those pretest effects and try and see if those are actually making a difference in our outcome. This also allows for an examination of interactions between pretest and treatment, which your book talks a bit more about those potential interactions, and we'll talk a bit more about those in a second. This is logistically and statistically challenging to examine, so it's a much more complex design. Most people opt for sort of a more traditional standard 2-group pretest post-test design because it is simpler to conduct and to then statistically analyze those data. A much more complex design, and I'll just talk about this one really briefly. This is factorial or multivariate designs. This is a situation in which we might have 2 or more independent variables that we want to look at simultaneously. So we randomize everybody. We do a pretest for everybody, some manipulation, and maybe a second manipulation for everybody. So maybe we have a situation in which everybody is getting some educational component, but only 2 of the groups are getting some psychotherapeutic component. And so we have a couple of different independent variables that we may be examining here. And then we're looking at pretest, post-test in each of these groups. A lot of you probably hear about randomized controlled trials. Your book talks a bit about this. These are kind of the gold standard of clinical trials. In a lot of cases, we're looking at either efficacy versus effectiveness. And this can be thought about as trial effects versus practice effects in some ways. So efficacy would be, does this intervention or manipulation work in a sort of laboratory controlled setting? Effectiveness would be doing this same sort of analysis and examination in an actual real world setting. So out in the world, do we see actual effectiveness? These are often expensive and very labor intensive. A lot of huge federally funded grants that we see will use these randomized controlled designs. Those are very, very expensive and often not what people are doing for dissertation research because they are incredibly involved. So let's move and talk about quasi-experimental designs. One of the key features of quasi-experimental designs is that they do not involve random assignment. They may or may not involve control groups, and there is still a variety of design options within these quasi-experimental designs. So one is interrupted time series design, in which we have a series of observations, a manipulation, and another series of observations. This allows us to think about maturation effects, which I think your book talks about a bit, and I'll talk about more in a second. We also have to consider that multiple measurements of the same variables may impact how people respond to that for a variety of reasons. An equivalent time samples design allows for multiple interventions to be tested. So again, this is similar to that multivariate or factorial model in which we have a couple of different kinds of things that we want to test. So we have some sort of manipulation or intervention, an observation, another one, an observation. These are sometimes used in social psychological research, and this allows us to test a variety of different interventions with the same group of people. Counterbalance designs is where groups are exposed to treatment conditions in a counterbalanced order to control for the effects of exposure and response to subsequent treatments, so like learning effects, comparison effects, something like that. And so this would be in which one group gets, let's say, intervention number 1 first, and then the other group gets intervention number 2 first. And so we can counterbalance those to see if there are any ordering effects. So for example, if you learn about sort of the basic educational components first and then get psychotherapy versus getting psychotherapy first and then getting some educational component afterwards, and we can see if there are any ordering effects in that way. And then again, this last one, non-equivalent control group design. This is what we think of in some ways as sort of a traditional experiment, and this is sort of a more traditional quasi-experimental design in which we have everybody getting a pretest, one group getting some manipulation or intervention, and everybody getting a post-test. So this is very similar to this true experimental pretest post-test design, but without randomization. In a lot of situations, randomization may be impossible, unethical, challenging for whatever sort of practical or logistical or ethical reasons. So your book does a nice overview and has sort of a checkbox of threats to internal and external validity and talks a bit more about reliability as well. We'll talk more about reliability when we start talking about instrumentation and measurement, but I'll go over a few of these factors right now for internal and external validity. Internal validity refers to the truth in our conclusions of causality. And your book goes over some of these. The Creswell book also goes over some of these. There are a variety of threats to internal validity, our ability to make these causal claims. Some of them may be history effects, things that happened during the course of the experiment, some major events in the news, medical breakthroughs. This is something that we're seeing now in the last 5 or 6 years for people who were in HIV prevention trials. PrEP, or pre-exposure prophylaxis, was FDA approved in summer 2012. And so a whole host of people in HIV prevention trials now had access to this entirely different way of preventing HIV. So many HIV prevention trials have relied for years and years on getting people to use condoms consistently, correctly, etc. And now we have a situation in which people can take a pill and prevent HIV. And so that is a sort of major history effect in our testing of that particular intervention. Maturation effects, this happens in longitudinal research, particularly over longer periods of time, in which participants just get older and the outcomes might change, their knowledge may change. Substance abuse research, this is something that we see. So as people get older, they tend to, not always, but they tend to mature out of some drug use patterns, drinking patterns, just changing those patterns as they get older. So depending on sort of our time course here, we may have some maturation effects that threaten internal validity. Your book talks more about the testing effects of pre-testing impacts post-testing, so you may get better at the test, learn the right answers, learn how to answer them in a way that you think the researcher wants you to answer them, perhaps. We'll talk more again about some of the instrumentation components when we get to measurement, but our instruments may actually not be valid, which would then impact our internal validity, our ability to make causal claims. Selection bias, we may have non-random selection of participants or group-specific differences in maturation if our groups are not equivalent in some ways. We're always dealing with potential regression to the mean, so tendency for scores to, so high scores can only go down, low scores can only go up, and regression to the mean is something that we see sort of more generally in research. We have mortality and attrition, which your book talks about some, so potential death or just discontinuation of participation. Attrition, I would say, in longitudinal research, experimental designs like this is an incredibly challenging thing. Getting people in the door is one of the hardest parts of doing research, and keeping them engaged is potentially the second most difficult part of longitudinal experimental research. We also potentially face the Hawthorne effect, where we have changes in behavior because of observation. So you're being watched, and thus you change your behavior. We also can see potential placebo designs, that people change their behavior because they are expecting some effects of the treatment. Diffusion of our conditions is also a potential issue, especially when we are conducting experimental or intervention research in sort of closed networks of people. For example, I worked on an intervention study with HIV positive older adults who were having trouble adhering to their HIV medication and who were drinking heavily. And so, oftentimes couples would come in and do the research, and we were randomly assigning people to groups, which might be really challenging if you have, for example, a husband and wife or a partnered unit, and you put one in the experimental or the intervention group and another in the control group. It's very likely that the person in the experimental group or the intervention group is going to go home and share some of those skills that they learned and some of that content. And so that person in the control group is not really getting sort of a pure control. They may actually be getting some of those intervention components. And that's a situation in which you'd want to think about if you'd want to non-randomly assign both pairs of a couple or a friend group to the same condition. And that would be something that you have to think about how much those effects might impact your internal validity. The location or the context of the intervention may matter in terms of thinking about the cause and effect, and there may be interventionist effects as well. So we often try and train people and make sure people maintain fidelity to protocol, but you may have a particular interventionist or assessor or somebody who's conducting your experiment who is doing something in a very particular way. And so you have to think about that in terms of how that impacts your ability to make causal claims. In terms of external validity, this refers to the ability to generalize these results to the real world. This is often when we talk about generalizability. So does this effect exist out in the world? There are obviously a variety of threats to external validity. We talk probably most about sample generalizability, so how similar is your sample to this population out in the world. And so that impacts our ability to make these claims about whether or not these effects exist in the world. And again, your book talks about this. We have some interaction of testing and treatment, so our intervention may only have effects when combined with this pre-testing and monitoring of behavior. If we were just going to implement this out in the world and not conduct this pre-test, post-test sort of monitoring of behavior component, maybe we wouldn't see these effects. So again, they might not exist out in the real world. And we may also have a setting treatment interactions, or intervention maybe only works in a very narrow setting and can't be duplicated in the real world. This may be something that we see when we move from laboratory field testing or laboratory testing to field testing. So if you're going to do some sort of an intervention in a laboratory setting that is not your doctor's office or not your school, not the setting in which we would then want to actually deliver this intervention in, it may have a very different effect than if you're doing that intervention in a school or a clinic or whatever. So I'll talk about a few miscellaneous design issues and thinking about experimental designs or quasi-experimental designs. And this may be particularly relevant to thinking about interventions. So one is fidelity to protocol. So you've designed some intervention or manipulation, and you want to be able to be sure that all of your research staff or everybody who is delivering that intervention or manipulation is doing it in the exact same way. So you have to have very clear and specific protocols, training of people, paying attention to personal biases, styles of interventionists, etc. This is something we obviously talk about a lot in curriculum. So we have certain curriculum that we think are effective. Maybe they are evidence-based interventions or something like that. But as many of you know, when you actually take that and deliver it in a school setting, you may do that very differently. You may pick and choose the pieces of that you actually want to implement. You may deliver it in a very different way than it was intended to be delivered. And not because you're ill-intentioned, potentially because it actually may be more culturally appropriate, or there may be sort of political constraints on how much of the intervention you can deliver and how you can deliver that. So we have to think about that anytime we're actually testing an intervention. In a lot of the interventions that I've worked on, we've actually done some level of review of the intervention delivery. So we've filmed staff in therapy sessions. We've had in motivational interviewing interventions that I've worked on, we have done a motivational interviewing treatment integrity protocol, where we've actually had independent raters assess the therapist's adherence to motivational interviewing protocol. And that's a way to sort of check that fidelity to protocol. You can ask subjects what their experience was and get a sense of if that experience is different across your subjects. As I mentioned before, the control condition design impacts the conclusions that we can make from our comparisons between the control and treatment groups. This also involves some ethical considerations. So do we have some sort of an attention control where we keep their attention for the same amount of time and engage people for the same amount of time? Because perhaps there's something about engagement that has some effects. So do we have an attention control group? Do we have a waitlist control such that the people in the control group don't get anything, but eventually everybody gets the intervention? We just put them on a waitlist and give that to them after we've already done the post-test assessment. A lot of times in HIV research and in health research more generally, we think about what the standard of care would be. So what would you get if you were to go to your doctor's office or your local LGBT center, or what would you be getting out in the world in terms of HIV care or prevention? And we would want to maybe compare our treatment group to that, because it might be that nobody in the world is getting nothing. So comparing a treatment condition to nothing, in a lot of ways, anything might be better than nothing. And so we don't necessarily know if our intervention is better than what they would already get out in the world and the kinds of education or care that they would already be getting. Or do you give them nothing and have that basic comparison to getting absolutely no engagement, nobody paying attention to you, monitoring behaviors, things like that. Retention is a huge issue. We have to think about how much money we're giving people, what kinds of services we might be offering them, how we're engaging them. Thinking about some of the cultural competency pieces of these designs is probably really critical in thinking about retention to our intervention. We also have to think about the design of our baseline and our pre-test and post-test assessments. So we measure the same constructs both times. We always avoid assessment by the interventionist, so whoever delivered the intervention, therapist, educator, whatever. It's really important that we don't have them also conduct the assessment of behavior. In that situation, you're much more likely to have a participant tell you what you want to hear. Maybe they like you and they really want to show that you were effective in helping them change their behavior. And so if you're not having that same person assess them, you minimize the chances of that. You don't eliminate them entirely, but you minimize them. We also want a blind data collection, so we randomize people to conditions after we do their pretest assessment. And then ideally, research staff should be as blind to condition as possible at post-test. And there may be a variety of very subtle ways in which we convey to them what we want their answers to be based on their condition. And so blinding the research staff to condition can be a really important piece of that assessment. We can also ask them about their self-perceived impact of the intervention and their experience in the intervention, what's often called acceptability assessments, and I'll talk more about that in a second. And then we want to also make the participants blind to conditions. So we don't want to tell them necessarily, you're getting the control condition, the one that we don't think is going to have effects. Sometimes they figure that out on their own, but we can tell them that we're testing different ways of engaging with people, and that this is the condition that they've been randomly assigned to. So this is in the Creswell text that I uploaded, a quick experimental design checklist to think about all of these factors that are important for experimental design. So what our participants are, what are the inclusion-exclusion criteria, how will they be selected or assigned, how many people in each group, and we'll talk more next semester about power analyses. What are your dependent variables, how we measure them, do they have established reliability and validity, which we'll talk more about again when we get to instrumentation. And what is your treatment condition? How do we operationalize that? Are there variables that you want to also assess that will covary in analyses? And then which design will you use? How will you go about that? Sort of what are the steps to that procedure? What are these potential threats to internal and external validity, and how will we address them? We do a pilot test and sort of run through everything before we actually do a full trial. We'll talk more next semester, obviously, about how to analyze the data and interpret those results. And so as we evaluate experimental and quasi-experimental research, we want to think about some of these components. So the quality of the intervention. Do people like it? So that's a huge factor. Maybe we find some effects, but everybody hates it, and so we actually can't deliver it out in the world. Is it feasible? Did we develop a 20-session intervention that can only be delivered by PhD level trained therapists, in which case that's never actually going to go anywhere in the world? Is it theoretically based and grounded in the research literature? And perhaps most importantly, is it strong enough to enact behavior change? As probably all of you know, behavior change is an incredibly challenging thing to elicit. And so our interventions have to be pretty damn good to get behavior change. And then we want to be able to evaluate the evaluation of that intervention. So do we have a large enough sample? Are our measurements good? So these are all things that we need to think about. There's a lot of moving pieces in experimental and quasi-experimental research that we have to think about, particularly as they impact internal and external validity. So now let's move to non-experimental research designs. We'll talk more later in the semester about survey research, so I'm not going to go into much detail about that right now. I'll talk a little bit about correlational research, causal comparative research, or what your book calls comparative research, and evaluation research. So I'll do a little bit of a primer on correlations right now. We'll talk obviously much more about correlations next semester, but this is a quick overview. Correlations describe relationships between two variables, sometimes more, but we'll talk about two right now. Correlations allow us to see if two variables are moving in the same direction. And so you'll often hear about negative versus positive correlations. Negative correlations indicate that as one variable increases, the other one decreases. So an example of this might be as someone's sexual anxiety increases, their sexual satisfaction decreases. So those are two variables that move in the opposite direction. Positive correlation indicates that as one variable increases, the other one also increases. So an example of this might be as sexual satisfaction increases, relationship satisfaction also increases. Those variables move, they increase as at the same time, so they move in that same direction. And when we run correlational analyses, these correlations indicate the statistical significance of that association, which we'll talk a lot more about next semester, so don't worry so much about that right now. The direction of the association, so negative or positive correlation, and how big that association is. And correlation values, what we call R values, range from +1 to -1, and the closer it is to 1, the more perfect of an overlap is. We can think of, probably many of you have seen those, the overlapping circles, as a way of thinking about how much variability two variables share. Don't worry so much about the statistical pieces or the mathematical pieces of this just yet. We'll talk more about those next semester. But conceptually, this is the correlation is telling us how big that association is. We often talk about an R-squared value indicating the proportion of variability in one variable that can be explained by the other variable. And so correlations help us make predictions. A correlation is one of the basic components of being able to run regression analyses in which we can predict one variable from another. Correlations are also a key component to thinking about causation. So that's a sort of a quick overview of correlations sort of more generally, and correlational research seeks to examine these associations. So one that you'll see a lot in a lot of textbooks, statistical analysis books, data analysis books, is the association between SAT scores and college GPA. We're able to look at huge data sets and understand these associations. Is there an association between sexual satisfaction and relationship satisfaction? So that's an example of a correlational research question. Is self-esteem associated with contraceptive self-efficacy? So does our individual self-esteem associate with our belief in our ability to effectively and consistently use contraception? Is depression associated with sexual satisfaction? So these are some basic examples of research questions that are correlation research questions. You probably have heard this a million times, but I will say it again. Correlation does not equal causation. So we know that just because two variables are correlated doesn't mean that one causes another. So again, we have to think about temporal ordering of variables and whether or not our experiments are true experiments and we can actually make some claim to causation. There are some ways in correlational research that we can make some level of causal claims or think a little bit about causation. And these are these causal comparative designs. And so your book talks about comparative designs and comparing between nations is what your book talks a bit more about. And so in causal comparative design, we're actually making those comparisons, but trying to assess some level of causation. And so your book talks about variables that are variables we can't manipulate. So we can't change gender. We can't say that race or ethnicity is something that we would manipulate or vary. And so we can make comparisons between racial and ethnic groups, gender groups, things like that. And we can make some level of causal claims about those group differences. And so certainly not necessarily strong causal claims, but we can say that race or ethnicity causes a difference in some score or creates a difference in some outcome score. Again, these are not as strong as experimental research, but often much more practical or ethical than experimental research, and sometimes it's just not possible to understand, to manipulate certain variables like race. I'll do a quick overview about evaluation research. One of the things that I would like to see us do in this program is create an entire program evaluation course. I think many of you will go on to do some level of program evaluation, and having a course in that would be useful for you, but this is the two-slide version of evaluation research. In evaluation research, we're typically determining implementation, effectiveness, and efficiency of a program and intervention. We use those results to decide on what programs we'll implement, to change those programs, to better understand how they work. So these may be experimental or non-experimental or quasi-experimental. Process evaluation of an intervention involves the examination of the implementation of the program, so fidelity protocol, were any adaptations made, things that how did that process of implementation go? Whereas a summative evaluation examines the final effects on our program outcomes, whatever our dependent variables are. And in evaluation research, the focus of that research is often a variety of foci. So what is the need for the program? Typically doing some sort of a needs assessment. Can we actually evaluate that program? So can we get in there and do the kinds of measurements that we need to be able to evaluate the efficacy or effectiveness of a program? How does that program operate in general and in this environment? So this is that process evaluation component. And then the summative evaluation component, again, is what is the program's impact? So what are the magnitude of the effects? Another component that's often looked at is how efficient the program is. So an efficiency analysis or a cost-benefit or a cost-effectiveness analysis. So maybe this program is actually effective. We think it's great. Participants love it. But it costs millions and millions of dollars to actually implement and stay true to protocol. And so, depending on how big the change that we see is or how important that change is, a public health impact of that behavior change may determine if that program is actually efficient to implement in the world. So, quick summary. All research designs, including experimental designs, have strengths and weaknesses. We have to think about these when we choose the design, when we discuss the limitations of our research. Again, I'll probably say this with every lecture, it's really important to have a well-defined research question going into it to be able to make those decisions about design. So for this module, you'll read Chapter 3 in the Breiman textbook. I'm also posting This American Life episode. It's about a half an hour long that I really strongly urge you to listen to. It's a great discussion of replication of research, which your book talks a little bit about replicability. And so it's a really important thing to think about how we replicate research, what are the constructs that we actually measure, how do we think about effectiveness. And so they talk about a variety of different ways of thinking about outcomes and what those outcomes mean and how we make sense of those. So I think it's a very easily accessible way to think about some of the constructs and concepts that we talked about in this lecture. So as always, if you have questions, post those. Confusions, let me know. And otherwise, I will post something else next week.